tell me that I'm crazy, that there's nothing wrong with me.
They would tell her that she needed to go see a psychiatrist.
She was so close to death. She's seen that door.
I'll tell you honestly, I would have rather had somebody tear my eyes out than look at my daughter on this table.
Danielle's stomach was round. She looked like she was pregnant as a baby.
The thing that we did the most was pray.
Next, two medical mysteries that defied the experts. Mary Ann Piazza is a healthy college student looking forward to a bright future until a seemingly ordinary cough begins to turn her life into a living nightmare.
There were times when I wished that I was dead because I knew, well, if I'm dead, I'll feel better.
Then, Pam and Dave Barquette can't wait to bring their newborn daughter home, but they are completely unprepared for the terrifying series of medical emergencies that will literally take over their lives.
I really thought she was going to die. I just was gonna say goodbye.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. In the spring of 2001, Mary Ann Piazza was a lively 20-year-old, juggling a very hectic schedule. When she wasn't studying for her degree in early childhood education, she was working at a local daycare center in Helena, Alabama.
I love my job because I was able to work with 2- and 3-year-olds, which at that time was my passion. You know, I had tests to study for, homework to do, just going back and forth to work and school.
She was always on the go. She was full of energy.
Her two sisters know firsthand. In fact, all 3 girls live at home with their parents. So when a nagging cough begins slowing Mary Ann down, her close-knit family takes notice.
She would have the cough from the time she woke up in the morning and until the time she went to bed. It never really went away.
I could feel it sort of in my lungs, and it was like a constant cough. And I thought at the time that it was just a cold, but it lingered longer than I thought that it should.
Determined to kick the cough, she visits the family doctor, who suspects she has a mild chest infection brought on by a seasonal cold.
I was prescribed antibiotics, and I took those, and the cough seemed to subside and go away.
By the time summer rolls around, Mary Ann is feeling like her old self, filling her days with work and school. Then, when she least expects it, she meets someone who will change her life.
When I first met Mark, I could tell that there was really something there. It was just kind of maybe love at first sight, I guess you could say.
One of the things that jumped out at me when I first saw her was her smile. Her smile just brightens up a room, and her eyes, they give away whatever she's feeling.
Mary Ann and Mark quickly become inseparable. But the irritating cough she had 8 months earlier suddenly returns with a vengeance.
The cough became worse. Normally when I would get sick, I would bounce back quickly, so it concerned me.
Alarmed, she checks back in with her doctor, who, once again, promises her that her seemingly ordinary cough is nothing to worry about. But as summer turns to fall, her hacking cough hasn't let up, and a foreboding new symptom begins to emerge.
I was starting to experience more fatigue. I was getting very tired.
She would come home early and lay on the couch because she didn't feel well, and it seemed very strange for her to be acting that way.
The lack of energy concerned me because here's a woman in her lower 20s. She shouldn't be having energy problems. I mean, she should be, you know, up and moving around, bouncing around.
Growing more and more concerned, Mark convinces Mary Ann to make one more appointment with her doctor. This time, he orders a chest X-ray. And when the results are in, it's clear that Mary Ann has more than a run-of-the-mill cough. There's a small shadow on her right lung.
He explained that the spot there was what a doctor would normally see from pneumonia.
The shadow indicates that there's some fluid accumulating in Mary Ann's lung, a common sign of pneumonia. But he reassures Mary Ann that with a course of antibiotics and a daily steroid inhaler, she should bounce back within a week.
I was pacified. I was like, okay, well, we know what it is. I've got medicine for it. I was just going to take the week off from school and work to recuperate.
She follows the doctor's orders, and in a few days, Marianne is starting to feel a little better. But 2 weeks later, her cough returns, worse than ever.
The cough, didn't go away like I thought it would. So I was given more of the same treatment.
Over the next 2 months, Marianne finds it harder and harder to get to class on time. She's completely drained. But Mark is becoming her cornerstone, the one person she can count on no matter what. By December, she has no doubt that he feels the same.
He proposed on December 1st of 2001 in the same spot that he told me that he loved me for the first time.
About the time she realized that my head was actually losing altitude as I was starting to do the kneel thing, she freaked out.
Bless his heart, he was on one knee and the ground was cold, and he said, "Are you going to answer me?" And
she said yes, and that was it.
Soon after, Marianne makes another big decision, to quit her job and enroll in school full-time. But it soon becomes clear that her bouts of fatigue are growing more pronounced by the day.
It was taking me longer to get ready in the morning. I was oversleeping a little bit. Normally, I would just wake up and I was just ready to go immediately. So it wasn't like me to feel bogged down.
Marianne stays in regular contact with her doctor, but to her dismay, he repeatedly dismisses her troubling symptoms as the lingering effects of a generic chest infection.
I would call my doctor a lot, just simply saying, "I'm ready to get rid of the cough." It's affecting my life completely at this point. I started to think, well, maybe I'll never feel quote-unquote normal again.
For more than a year now, 21-year-old college student Marianne Piazza has been struggling with a chronic cough that is beginning to take over her life. She's so fatigued that even getting out of bed every morning has become an enormous challenge.
It was almost like her body was telling her there's something very, very wrong, but yet she had doctors telling her that it's nothing huge.
She's been to see the family doctor more than 8 times. But each time, he's assured her that the symptoms will go away. They're just the remnants of a chest infection she had 7 months earlier.
I began to get frustrated when I didn't feel like I was getting any real solid answers. It's just, you're overwhelmed with school, it's just too much stress.
But when a number of alarming new symptoms begin to emerge, Marianne is certain that there is something seriously wrong with her.
I was starting to feel like out of breath. Just doing normal activities with walking, climbing stairs, was a challenge.
She's never experienced anything like it before. Just a year earlier, she'd been the epitome of good health, and suddenly, daily activities have become a struggle. Then, as the months pass, she can't help but notice another unmistakable sign that her body is changing right before her eyes.
My sister was engaged and her wedding was approaching. We all got fitted for our bridesmaids' dresses, and then when the gowns came in, I could tell, well, it's too big, but I just got sized for it. It was kind of odd that I would just lose weight for no reason.
She was initially happy about it because she was thinking, great, I can wear these cute little things I've always wanted to wear, but the weight loss never stopped. And it reached a point where she started getting worried about it.
My pants weren't staying up. My shirts were getting too big. I would even start to avoid mirrors.
2 months later, Marianne has lost almost 10 pounds without trying, leaving her feeling like she's wasting away. But she could never have imagined the bizarre symptom that would rear its head next.
I remember one night I woke up just completely soaking wet. My pajamas were wet, even the bed linens were wet.
She would even call me at my house and say, Mark, just talk to me until I get back to sleep. I just woke up and I'm soaking wet. It's like I've been swimming.
It seemed like just one more problem that I was having. The shortness of breath, the wheezing, the fatigue, the weight loss, the cough. I now had night sweats.
I would answer the phone and I would try to take her mind off it, get her mind into a good place where she could kind of doze off on a happy note and not an I'm scared note.
It persisted every night. Then it progressed to itchy skin.
It was just uncontrollable itching to the point where she'd get up in the morning and there would just be giant track marks down her legs. She would just do it in her sleep.
Mark would always tuck me in before he would go home for the night, and he would kind of start this little routine of putting socks on my hands so that if I scratched my legs that I wouldn't hopefully make my legs bleed, but I would always take the socks off my hands during the night.
We weren't going to do something like duct tape it on, although we did joke about it.
It was just a series of making accommodations for all the things that were going on in my life.
By December 2002, more than a year after her family doctor diagnosed a simple case of pneumonia, Marianne has hit rock bottom. Now desperate for answers, she goes back to him, convinced that these new symptoms will be the clues he needs to finally put the pieces of the puzzle together.
I approached my doctor with the weight loss, with the night sweats, with the fatigue.
This time he appears to be more attentive and performs a thorough top-to-bottom exam. But nothing could have prepared her for his shocking diagnosis. The doctor, who has treated Marianne since she was 15 years old, believes that she's anorexic.
When I got that answer from him about being anorexic, it was more than just frustration. It was almost more of an anger. It was, why is it that I can come to you several times with the same symptoms and they're getting worse? However, I'm not getting anywhere. I'm just being passed off and ignored.
Angry and insulted, Marianne realizes that she's reached her breaking point. She needs to see another doctor. This time, she makes an appointment with an asthma specialist, hoping she'll be able to figure out what's going on once and for all.
In the back of my mind, I would always say, well, today is the day. Today, this is all going to make sense. I'm going to know what's going on. I'm going to understand it, and it's going to go away.
As soon as she arrives at the new doctor's office, the nurses begin walking her through a series of tests.
I had to blow out with the same breath for 6 seconds, and I wasn't able to do that. And I can remember the nurses beating on my back, you know, telling me, keep blowing, keep blowing.
It was almost like they were bullying because, you know, she's thinking, I can't do this, leave me alone.
The nurses would say I was showing a poor effort, that I wasn't trying, but I knew that I was.
Within just 30 minutes of arriving, she's starting to get that familiar sinking feeling that once again, no one is taking her debilitating symptoms seriously. And when the doctor reviews her test results, she drops yet another bombshell.
I'm failing a pulmonary function test, but she referred me to a psychiatrist, thinking that all of my problems, all of my symptoms, everything that I had come to her with was mental. I almost wanted to give up.
For the past 3 years, 23-year-old Marianne Piazza has endured a mysterious constellation of relentless symptoms. A chronic cough, incapacitating fatigue, and night sweats like she's never experienced before.
I was at my lowest point. I was so weak, I wasn't able to open doors. I felt like I really couldn't do anything. Anytime I needed to do something that I really had to do, I would say, please God, help me, you know, get me through this.
Marianne has gone from a size 8 to a size 4. She can barely breathe going upstairs, and she's so lethargic that just walking to class at the local college is almost more than she can handle.
She was getting to class and she was having a hard time concentrating because she was so tired from the walk from the car.
And no doctor seems to be taking her very seriously.
Everybody's telling me that I'm crazy, that there's nothing wrong with me. No one is listening.
She would go to the doctor and, they would tell her that there was nothing wrong, that she needed to go see a psychiatrist.
What's worse is that even her family is starting to doubt that she's sick.
The doctors I had gone to were explaining that I can't find anything significantly wrong with you. So my family just thought, well, are you just doing this for attention? Why are you acting this way?
I was starting to wonder if she was just really depressed.
There were times when I wished that I was dead, because I knew, well, if I'm dead, obviously I can't feel this way anymore, and I'll feel better.
But Marianne refuses to let her agonizing symptoms break her spirit. In May 2003, 3 years after she first became sick, she decides to try one last doctor, internist Dr. Amy Lejeune.
My nurse called me aside and said that she'd got a call from a patient who was complaining of shortness of breath, maybe a little anxious, maybe having some panic attack type symptoms. It was a busy day. My schedule was full, so I said, sorry, we're full today.
But this time, Marianne won't take no for an answer.
And they said, this patient that called that was short of breath, she's at the window now. She wants to be seen. I thought, that doesn't happen very often, and so it struck me that she was that persistent. Maybe I should change my mind.
Dr. Lejeune instructs her nurse to begin taking Marianne's vitals and find out what she can about her medical history.
The nurse took my temperature and asked, why are you here today? And I went through all of my symptoms.
She told me that Marianne was a young girl who had been having some problems with breathing, and maybe she was stressed and having anxiety attacks. And as I was hearing all this information, I was glancing down at the chart and I noticed that she had a fever.
A fever is often the body's way of fighting off an infection. It's a crucial clue that Dr. Lejeune cannot ignore.
And I said, wait a second, what about this fever? Did you ask her what could be going on there? And she said, oh no, I didn't, and I said, well, we need to find out about that.
The nurse immediately orders a full blood workup, a urine test, and, for the first time since her diagnosis of pneumonia 2.5 years earlier, a chest x-ray. But no one is prepared for what it is about to reveal.
Our radiology technician did the x-ray, and she came and she said, you've got to look at this. Essentially, the entire right lung was opacified. It's supposed to look dark, which is the appearance of air on a film, but it was white. It was not a good-looking x-ray.
Dr. Lejeune takes a deep breath before sharing the ominous news with her new patient.
At that point, I had not even met Marianne yet, so I went in and introduced myself and said, I understand that you've been having some symptoms that are worrying you, and I can tell you that there is good reason for that worry. There is definitely something wrong. There's something in your chest, and we've got to find out soon what that is.
She put the films up on the screen, and she showed us the shadow, and she said, this is not supposed to be there.
On a warm spring day in 2003, Dr. Amy Lejeune finds herself unexpectedly rushing 23-year-old Marianne Piazza to the University of Alabama Hospital. She has just met her this afternoon and realizes that Marianne's life is in her hands when an x-ray reveals an unidentified mass the size of a football growing in her chest.
When she told me that there's something in your chest, it made sense that I'm not completely crazy. She was able to put the pieces together and to listen to me, and that's what no one had done for the past 3 years.
Now, the hospital staff is completely focused on confirming exactly what's developed in her chest. They immediately prep Marianne for exploratory surgery. It's imperative that they perform a biopsy to find out what they're dealing with. But all Marianne can think about is Mark, who is desperately trying to get to her side.
I was actually in Ohio, and that's probably the most helpless I've ever felt. Was having just these irrational thoughts of, is she gonna die before I get home?
Mark walks into the room just as they wheel Marianne in, along with Dr. Andres Ferrero, who has been assigned to her case.
Doctor came in and told her that we have a diagnosis.
Her diagnosis was what we call a Hodgkin's lymphoma.
Hodgkin's lymphoma is a common type of cancer that starts in the lymph nodes where infection-fighting white blood cells are stored. The lymphoma essentially breaks down these cells, interfering with their ability to do their job. This leaves the body vulnerable, making it possible for the cancer to spread and grow in the form of tumors.
The majority of the time we find the disease in a very early stage. And the problem is that by the time that she was admitted to the hospital, the tumor was about 25 centimeters by 15 centimeters in diameter. When you have this amount of tumor growing in your chest, then that can compromise your ability to breathe, and that's a very serious condition.
She got a little pout on her face, and then she started to smile. And the doctor says, do you understand?
I couldn't help but say, you have to understand that for all these years, that's all I've wanted, for someone to tell me what was wrong with me, and now you just have.
It was a tumor about roughly the size of a football in her chest, and it had compressed one of her lungs and actually physically moved her heart over. And of course, this explained all the shortness of breath, all the low energy, because, she wasn't getting all of her lung capacity.
In fact, nearly 75% of her lungs are completely obstructed. As for Marianne's other symptoms, 1 in 4 patients with Hodgkin's lymphoma will suffer weight loss, night sweats, and itchy skin.
I felt guilty because I feel like I should have known that there must have been something really wrong.
Inside, I was going, it's not fair. She is such a good person. Why is she having to go through all of this? She was so close to death. She has seen that door.
After she is diagnosed, Marianne is immediately transferred to the oncology ward, where Dr. Ferrero begins her treatments.
The good part about Hodgkin's lymphoma is that it's a disease that is extremely sensitive to the treatments that we have developed for that. And that includes chemotherapy, and that includes radiation therapy.
Chemotherapy is a regimen of toxic chemicals intravenously delivered to patients to destroy cancer cells. Used in combination with high doses of radiation, it can be extremely effective in treating some cancer patients. But the treatments require months of follow-up and can cause devastating side effects.
It was the sickest Marianne has ever been. And through all this, I was basically just trying to keep it together.
The multiple treatments shatter Marianne's fragile body, leaving her too weak to even speak.
Having Mark by my side kept me going. Because there were times when I wanted to give up. Since I wasn't talking, I still wanted to communicate with Mark. So I would always say, I love you. So I would just kind of motion to him.
That gave me more strength to deal with what was going on, because it was almost like her reassurance of, I'm in here still.
Finally, after 17 long months of painful recovery, Marianne is declared cancer-free.
When we heard that Marianne was in remission, it was like Christmas and your birthday all on the same day.
It felt like such a burden had been lifted off of me. I felt at peace. And I had not felt that way for years.
And after more than 3 years of waiting, on January 15th, 2005, Mark and Marianne finally get married. Today, 2 years later, they continue to live in their small town in Alabama. Her long recovery forced Marianne to give up her dreams of teaching, but she's settled into a job she loves at the local bank. Unfortunately, Marianne's cancer has come back twice since she was first diagnosed. It's a common occurrence with a late diagnosis.
We can cure a lot of patients with Hodgkin's lymphoma. But of course, your chances of being cured are much higher when you are diagnosed in a very early stage.
Nevertheless, Marianne considers herself fortunate that she was ever diagnosed at all.
When I think back to all the years of going to different doctors, I feel that I was ignored because I was so young.
It came across almost like it was like she was being written off.
One of the lessons that I have learned from Marianne's case is that if you treat a patient for some symptoms and the patient comes back to you with the same symptoms, you have to explore a little bit more and trying to find a different diagnosis.
I hope that more than anything that comes out of this, that people know that you have to keep going. Even if someone tells you you're fine, you're healthy, just to keep going and not to give up.
For almost 3 years, Marianne Harvard lived with a seemingly benign cough before anyone realized it was the hallmark of a deadly disease. But within just 3 months of their daughter's birth, Pam and Dave Barquette know all too well that her life is in danger. In the spring of 1995, Pam and David Barquette were busy preparing their New Jersey home for their first child, a baby girl.
We found out she was a girl, which is really what I wanted, and I was so excited. I couldn't wait to go shopping.
I was overjoyed. We fixed up a brand new room for her.
It was a positive time.
With her pregnancy going smoothly, Pam eagerly looks forward to each doctor's visit to learn how her baby girl is doing. But at her 8-month checkup, a routine blood test reveals something out of the ordinary.
All the prior ones were normal, but this one wasn't. It was the alpha-fetoprotein one.
This standard test checks the levels of protein and hormones being produced by the fetus. High levels of alpha-fetoprotein can often indicate a birth defect. It's the last thing the Barquettes ever expect to hear.
They said it could be just a false positive, or it could be Down syndrome.
I didn't know if I was special enough to have a special child. Most people have the anticipation of having a normal child.
I was so scared, I didn't know what was wrong.
As a next step, the doctor performs an amniocentesis and an ultrasound to confirm the findings.
The amniocentesis test was slightly high, but after the ultrasound, they told me everything was fine. She had all the correct organs. There was nothing wrong with her, so I was very relieved.
1 month later, on May 31st, Danielle Antoinette Barquette is born, weighing 6 pounds and 6 ounces.
First time I saw her, she was like a little peanut, tiny. She was really, really small, but very, very beautiful.
The doctors came, they handed her to me. She was fine. There's nothing wrong with her.
Relieved that Danielle is healthy, Pam and Dave take their daughter home and start settling into their new role as parents.
Danielle was an excellent baby when I brought her home. She'd sleep, she was happy.
She was just as cute as a button. She was really an adorable child.
But just days after bringing Danielle home, Pam and Dave begin noticing a disturbing pattern.
Feeding her was always a chore. You give her a bottle, no matter what time it was, she'd throw it up. So you give her more, she'd throw it up. Some would stay, someone. It was just a problem to feed her.
I just figured this was normal, how kids act. Most kids throw up until you get them on the right type of formula or get something that doesn't irritate their stomachs as much.
The Barquettes stock up on various types of formulas to see if Danielle can keep any of them down, but none of them seem to do the trick.
Feeding her came to be clockwork after a while, because we knew that as soon as we gave her the bottle, she was going to throw it up.
Not only is she throwing up after every meal, Danielle is starting to experience daily bouts of diarrhea. But Pam is even more troubled by the fact that her 3-week-old daughter seems to weigh about the same as the day they brought her home.
She wasn't really gaining weight. I realized there could be something wrong, and that's when I brought her to the pediatricians.
The doctor gives Danielle a thorough examination and isn't alarmed by her condition. She reassures Pam that her daughter probably just has a sensitive stomach and that she should grow out of it in a few weeks.
They said, well, we'll keep an eye on it. Next visit, we'll see what happens. I was happy with the answer the doctor told me because I didn't want anything to be wrong with her.
Over the next 3 weeks, Pam is hopeful that the chronic vomiting will start to taper off, but it doesn't. Meal after meal, she throws up. When Pam takes Danielle in for her 2-month checkup, she is expecting grim news and anxiously waits for the doctor to weigh her.
She did gain weight. Not a lot, but a little. So I assumed that it would just keep going up from there and that she would be fine.
Relieved, Pam continues to monitor Danielle's growth. And slowly but surely, she continues to gain weight. But when Danielle is 3 months old, the entire family notices an altogether different and bizarre symptom.
It was my father's birthday, and we were chatting like most families do.
I mentioned how Danielle was growing. And my son-in-law said, yeah, but it's a little funny.
My husband noticed she was checking on her, that her stomach looked really big.
He lifted up her little outfit, and her stomach was distended.
Danielle's stomach was round. She looked like she was pregnant as a baby.
Three months after Pam and Dave Barquette bring their newborn daughter Danielle home, they're sent into a state of panic when they realize that her tiny abdomen has nearly doubled in size. Pam immediately takes her in to the pediatrician, who is also alarmed by what she's seeing.
They looked at her and they said that she could have a hernia.
Danielle's stomach could be protruding because of a hernia, a bulge that occurs in the abdomen when an organ is out of place. If left untreated, hernias can cause irreparable damage to vital organs. The only way to confirm her suspicion is to admit Danielle to the hospital, where they can run diagnostic tests. It's the last thing Pam ever expected to hear.
I started to panic. I called my husband.
She goes, there's a problem with Danielle, and they're sending her to a specialist at Morristown Memorial. And I basically just dropped everything I was doing and just left.
And they rushed us to the hospital with her. And I had a surgeon meet me in the emergency room.
The pediatric surgeon immediately orders blood work, a CAT scan, and x-rays. As ER staff whisk their only daughter away, all the Barquettes can do is wait helplessly.
She's screaming and crying because she's scared and she doesn't know what's going on. It's just a scary thing to see that.
It was my instinct to want to be with her, but I knew that they knew what they were doing.
2 long hours later, the test results are in. Danielle does not have a hernia.
When they told me it wasn't a hernia, I had no idea what was wrong with her.
As Pam and Dave struggle to process this latest development, the team reviewing the CAT scan has figured out what's causing Danielle's distended stomach. Her abdomen is filled with ascites, a catch-all term for any fluid that builds up between the abdominal wall and the internal organs. They speculate that the fluid has been slowly accumulating over the past 2 months, explaining why Danielle was gaining weight, even though she couldn't keep anything down. Suddenly, the Barquettes realize just how sick their newborn daughter has been all along.
We're not doctors, we're parents, and it comes with no instruction manual.
At that point of our journey with her, we had no idea of what we were facing.
The news is worse than the Barquettes ever could have imagined. The ascites is slowly crushing Danielle's tiny lungs. If doctors don't act fast, the fluid that's accumulating could stop her from breathing.
My biggest fear is that Danielle was gonna die. And it was very hard, because I didn't know.
The team rushes to drain the excess fluid by inserting a catheter into Danielle's tiny abdomen.
I'll tell you honestly, I would have rather had somebody tear my eyes out than look at my daughter on this table.
But right away, the procedure seems to be working, and for the moment, Danielle is out of danger.
They were able to stabilize her once they drained the fluid out of her stomach.
Now that they have stabilized her, the team can focus on pinpointing what is causing the ascites. And despite their initial sense of relief, the Barquettes settle in for the longest night of their lives.
I spent the night in the hospital because they wanted to run more tests. It was a long day. I was tired. Sleeping was not an option.
How could you sleep? You know, you don't even know what's wrong with her.
All I did was watch her all night. I couldn't really hold Danielle because they had IVs connected to her. So I would just stand over her and touch her little face, her hand.
The thing that we did the most was pray.
The next morning, when the doctors check in on their tiny patient, they're shocked by what they find. For the second time in 24 hours, Danielle's abdomen is full of the deadly fluid. Once again, the clock is ticking, and the medical team begins running a battery of tests in a frantic effort to figure out exactly what's going on.
I had every specialist, resident, coming in and out of our room because they didn't know what was wrong with her.
I believe that they started out with the basic things, obviously blood tests and urine tests and things of that nature, trying to rule out if there was any levels that were way off the chart.
But as each test comes back, result after result shows that Danielle's heart, lungs, kidneys, and liver are all normal. For the next 3 days, the barrage of tests continues with no new leads. Desperate for answers, the Barquettes begin to wonder if anyone will be able to save their little girl.
I would think, oh geez, what's next? They've done all these other tests. They still haven't found it. What could be left?
With Danielle's condition rapidly deteriorating, the hospital calls in gastroenterologist Dr. Joel Roche.
Every minute counted. It was that type of situation. You feel pressure to make a diagnosis and hopefully effect a cure yesterday.
Shook my hand and said, let's see if we can't find out what's wrong with her. I think he immediately went over. I think he put his hand on her head. I'll tell you what, it meant a lot to me.
A specialist in digestion and liver disease, Dr. Roche is deeply troubled by what he sees.
She was obviously a very ill infant. Her abdomen looked like one of those old-fashioned Jiffy Pops. That is not a good sign.
He immediately suspects that her liver is shutting down, causing the fluid to build up.
The most common cause of ascites, certainly in adults, is from the liver.
But so far, all Danielle's liver tests have come back normal.
Even though her typical tests of liver chemistries were not suggestive of a significant liver problem, the question was, could this be coming from the liver anyway?
Determined to flesh out his hunch, he delves straight into Danielle's chart, scrutinizing every test they've run on her in the last 5 days. And it takes him only moments to notice one important test that has yet to be performed.
The best liver test that we have to tell me is the liver working is a test of clotting. That had not yet been done.
One of the most important functions of the liver is to create proteins that cause our blood to clot.
Once the liver begins to fail, the proteins that need to be made to allow for normal clotting are no longer made, and so the blood clotting test will become abnormal.
And just as Dr. Roche suspected, the test results are the first real breakthrough in the case.
They were markedly abnormal, which was a sign to me she was in severe liver failure.
This is the clue that Dr. Roche has been looking for, but the revelation also means that Danielle is sicker than anyone had ever imagined.
I really thought she was going to die. I just was going to say goodbye.
For the past 5 days, Pam and Dave Barquette have watched more than 30 doctors struggle to save their only daughter's life. Now, gastroenterologist Dr. Joel Roche thinks he knows what's causing her stomach to fill with a deadly fluid called ascites. Her liver is failing, and he suspects he knows why.
There are not many things that would put a 2 to 3 month old in severe liver failure. And then putting together the fact that she had basically normal tests that look for inflammation of the liver, I knew I had a relatively non-inflamed liver that just wasn't working. That smells a lot of very rare condition.
To prove his theory, he turns to Pam, hoping that she can provide a vital piece of information.
One of the markers is a very high alpha-fetoprotein. Knowing this is what made me ask the mother if she had ever heard anything about alpha-fetoprotein. And she sort of gave a laugh and said, oh, come on, someone must have told you that story. And I asked her what story, and she told me the whole story about the obstetrician and the elevated alpha-fetoprotein.
Dr. Roche immediately orders an alpha-fetoprotein test for Danielle. And the results are the last piece in the puzzle.
The alpha-fetoprotein is a protein that comes about from damage to the liver. And normal alpha-fetoprotein in an infant may be several hundred. Hers was 77,000. And seeing that level of elevation is almost diagnostic. We were dealing with tyrosinemia.
Tyrosinemia is a genetic disorder caused by the lack of an enzyme needed to break down tyrosine, an amino acid that is found in most foods high in protein, like meat, eggs, and dairy.
Infant formula, the regular formula, breast milk, anything that an infant will be eating has protein, and those proteins have tyrosine in it.
If patients with tyrosinemia continue to eat these proteins, toxic levels of tyrosine will build up in their system, poisoning their body.
Every time Danielle ate, she made herself sicker.
This explains her vomiting and diarrhea.
It started making sense. She couldn't tolerate the formula because she didn't have the enzyme to break it down.
In Danielle's case, her tyrosine levels were so high, they actually started to poison her liver. In response to these toxic levels, her failing liver quickly became unable to process fluid normally, causing her stomach to fill with deadly amounts of ascites.
Untreated tyrosinemia is uniformly fatal. So in a sense, the ascites did her a great service, because I don't know that we would be talking about Danielle the way we are today had she not gotten that swollen belly and sort of called attention to herself.
All the pieces came together. I was relieved. At least I knew what I was dealing with.
The Barquettes are thankful to finally have a diagnosis, but they still can't help but wonder why more than 30 doctors missed the critical clue.
One of the curveballs that tyrosinemia can throw, the liver doesn't get destroyed. In a sense, it gets poisoned. So the test that would tell me about abnormal turnover or death of liver cells don't clue me into a liver problem.
In addition, because tyrosinemia is so rare, only 1 in 100,000 children in the United States are born with it, it's not included in the wide range of tests medical experts usually run to assess the liver.
It's very rare, and most doctors have never seen it. I was very lucky that Dr. Roche saw this other case.
I diagnosed a child with tyrosinemia about a year or two prior to Danielle. So those clues don't have to be quite as loud or quite as large if you've already seen a case.
He knew exactly what to do and how to handle it.
With a diagnosis in place, Dr. Roche begins treating Danielle with an experimental new drug called nitasinone, or NTBC.
After he was confident that it was tyrosinemia, he let us know that there was a company in Sweden that developed an experimental medicine that could help trick the liver in the processing of protein.
Within days of the diagnosis, Dr. Roche administers the first dose of NTBC, and almost immediately, Danielle's life begins to change.
Once the NTBC, once the medication, which helps reverse the whole process, was given, within days she had a marked improvement.
She was eating and her stomach wasn't holding fluid anymore. She just seemed to be more alive. It was just, I knew she was going to be okay.
After 2 long months, Danielle is finally out of danger, and Dr. Roche expects that with the proper treatment, she'll be just fine.
For the rest of her life, Danielle needs a special diet, which is low in the amino acids, especially tyrosine, and she requires the medication NTBC, which is now FDA approved and available in this country.
Today, Danielle is 12 years old. She's a seemingly normal 7th grader who has learned how to live with her disease.
Danielle's health is fine. She's still on a low-protein diet and the drug.
I have to take 2 pills in the morning and 2 pills at night. It doesn't make me feel different. Well, it does, but I know that they can't really change it, so.
I don't feel that this was a step backwards for us. I think this is a very special thing to happen to her because it can help other people.
In a sense, she's writing her own book. Danielle and patients like her are going to tell us the long-term effects of her therapy.
Danielle's case has helped to prove that if diagnosed in time, genetic metabolic disorders like tyrosinemia can be successfully treated.
When babies are born in New Jersey, they test for 30 metabolic diseases, and now tyrosinemia is one of them.
Danielle is proving that each of these patients has a bright future in store.
Danielle is healthy, happy, extroverted, developing and growing like any other preteen. It's a wonderful thing to see.